Hello, everybody. Better Spaces is a health and happiness solution for today's hybrid workplace. My name is Dr. Paul Kachoa with PAR5 Physical Therapy here in Randolph, New Jersey, and I've partnered with them to bring you an easy and educational workday session. So today's session is 3 moves for core strength and a healthy back. A little bit about me. I'm a doctor of physical therapy, an orthopedic clinical specialist, and a level 3 Titleist Performance Institute certified golf medical professional. So if you have any questions during the session today, feel free to type it in the chat, and stay tuned for the question and answers at the end. Let's get started. Let me transition into my little slides here to start off. All right, so here we are, 3 moves for core strength and a healthy back. A lot of people are like, oh, I have a bad back. It's like 80% of Americans have some type of back pain, chronic or otherwise, throughout their life. And you've probably heard of the core. Like, oh, what is this core? I need to strengthen my core. Well, we're going to talk about that and how to prevent back pain from limiting the things that you love to do. So my first thing here is making sure that this is not physical therapy. This is just general advice that's targeted for a broad population. So I just need everybody to be aware that if you are dealing with something specific, please consult a medical professional to have a thorough physical examination, to have a treatment or exercise program that's tailored just for you. All right, so when we go through this stuff today, make sure that you don't push through the pain. You want to breathe nice and easy. And if something hurts, we can always modify things so that the exercise or the stretch shouldn't hurt, should feel better. And you try and combine them throughout your workday. You set aside time, maybe like a minute or 2 minutes every hour, just to kind of change position and get out of that static position. Humans were not designed to be in any one position for 30 minutes. Your body adapts to the positions and postures you place them in. So you don't want to be stuck, rounded, and just sitting at a desk all hunched over. All right. So if you've been to my classes before, you've probably seen this video. This is basically an illustration of how the body functions. The body functions on this alternating pattern of stability and mobility. If that pattern is disrupted, then pain or injury is what happens. That's the result. All right. So when we're thinking about, particularly when looking at back pain, the back should be stable. It should be a stable segment of the body. Oftentimes I have clients that come in to see me, they're complaining of back pain, but the problem is not the back. The problem is in the hips, because the hips are supposed to be mobile. And if the hips aren't mobile, your back is going to be unstable. Your body's going to try and seek a compensation or make up for the range of motion or mobility that it's missing at a certain joint above or below the segment, and then switch the roles. So if your mid-back or your hips are tight and immobile, your back is probably unstable or trying to be a mobile segment, and it's not designed to be that way. All right, so today, what we're going to talk about? We're going to talk about the core. The core is anything in the middle of the trunk here, basically your abdominals, your back muscles, but it also includes the hip muscles, because the back is intimately connected to the pelvis and the hips. All right, so if we look at the illustration here, we've got the abdominals, right? There's different layers of abdominal muscles. You have the most superficial, which is the rectus abdominis. The rectus abdominis runs directly up and down. It's basically everybody says, oh, this is the 6-pack, right? My son, he's 6 years old. He says that, Dad, I got a 6-pack, and he shows me his shirt. It's like it's the cutest thing ever. He still does it. Anyway, the 6-pack is basically this rectus abdominis. It runs straight up and down. The next 2 layers, you've got the internal and external obliques, which run diagonally. And then the deepest layer underneath all that is the transverse abdominis. The transverse abdominis runs like a girdle. It basically wraps around from your lower back all the way to the front. So if you've ever worn a back brace or a weight belt, the transverse abdominis is your body's natural weight belt or girdle. So it's super important to be able to control and activate that deepest muscle of the abdominal group. People with chronic back pain, when I come in, I put them on the table and I test them out. We're going to test that. We're going to test it later. when I test their transverse abdominis or their ability to control and activate that muscle, people with chronic back pain usually have no idea how to control or even activate this transverse abdominis. All right, so going into the back muscles, you have the big back muscles. You have the what do you call it? The trapezius, which goes from the base of the head all the way down to the middle part of your spine and connects out to the shoulder blade. But we also have the latissimus, which is the big muscle that comes from underneath the armpit, the front part of your arm, and then wraps around to the lower back. And then deeper to that, we have all the group of the paraspinal muscles, we just call them. They just run up each segment all the way up from your tailbone, sacrum, all the way up to the base of your head. All right? And then moving on to the hips. The hip muscles, very important. This picture right here, it might be a little bit confusing, but this is the viewing the body from the front, okay? So you have your legs down at the bottom, and then the pelvis, right? And then you can see the spine going straight up and down. So that's the viewed from the front. And what we're looking at here is a couple of muscles, the quadratus lumborum, that runs from the ribs straight down to the pelvis in the back right here. And that's typically something that gets tight on a lot of people. And then we also have this psoas muscle, the iliacus and the psoas muscle. Those two muscles come from the lower back and the pelvis, dive through the abdominal cavity, and insert into the front part of the hip. Now, that crosses many joints. It crosses the hip and the lower back joints. That can create a lot of stiffness or tightness in the hips, and also create a lot of shearing or pulling on your lower back. So those are things that we have to look out for as we get through this section. So 3 things that we're going to cover today: core strength exercises. What are we going to do to strengthen our core? We're talking about hip mobility. What do we need to do? And we're going to touch on body mechanics. All right. So let's get into this. I'm going to pull up my 2-shot here. So we've got the table. We're going to go over some core exercises here. Let's see if I can get this in the camera as well. All right. So the first thing that we want to do is test out your transverse abdominis. What you're going to do is you're going to lie down on your back. I'm going to kick off my shoes here. So you're going to lie down on your back, get on the floor, relax a little bit, take a second, and then with both of your knees bent, you're going to find your pelvic bone. Now, it should be simple to find your pelvic bone. It's a pointy part of your hip right in front here, and then you're just going to take your fingers, maybe like 2 fingers, and poke in there towards your belly button, okay? So if we come an inch inward from that bone and then come right into the belly button or close to the belly button, and you're relaxed, that muscle, that area of the body should be nice and soft. It should be supple. I can push into there. Now, I want you to pull your belly button into your spine. If you do this properly, pulling the belly button into your spine will activate your transverse abdominis. But the big thing is that you should be able to breathe at the same time as feeling that muscle contract underneath your fingers. All right, that area that we have our fingers is the only area that we can palpate that muscle, the transverse abdominis, contracting. So it should become firm as we pull the belly button into your spine and still be able to breathe. Oftentimes, people will substitute transverse abdominis muscle activity or contraction with the diaphragm. So you just got to suck in their breath and then create a hollow here, and then they cannot breathe. If you cannot breathe, you cannot function. All right? So once we have that, then we can go into 3 exercises that was developed by a Canadian biomechanist that specializes in low back pain to work on the core. So the first one is going to be a curl up. What you're going to do is you're going to take your hands, slide them underneath your back, all right, above the pelvic bone. So it's sort of like, above the belt line on both sides, okay? And then with one leg straight, you're going to push your back into your hands. As you push your back into your hands, you should feel, again, that contraction of that transverse abdominis. And we're going to push your back into your hands. You should feel that tension on your hands, and then raise your head and shoulders up. As you're in this position, you want to make sure that we're not pushing with the arms to get up, right? Because that becomes an arm exercise. We want to create that pressure into the hands and lift the head and shoulders and feel that tension right into the abdominals. So one leg straight, do it about 5 or 10 times, and then switch legs, and then we repeat. All right? It's not a full sit up. It's just trying to get you reacquainted or be able to connect your abdominals with your brain, particularly the transverse abdominis muscle. All right? The next one is going to be a side bridge to work on the lateral muscles. Now, you can do this in 2 different ways. You can go from the knees bent onto your elbow or with the legs straight. All right? So we're going to start off with this. This is like level 1 of the second exercise. You're going to just push off the side of the leg, lifting your hips up. And the key thing is if you look down, your shoulders, hips, and knees should be completely straight. We don't want to be able to, I'll show you from the side here, as we lift, we don't want to do this. My hips are still bent. I need to drive that hip forward so my entire body is totally straight and lined from shoulders, hips, to knees. All right? And then holding this for about 3 to 5 seconds is usually what I recommend. And if you can get through 10 each side. Okay? The other one that we're going to go through to work on the back and coordination of your abdominal control and stability is the bird dog, they call it. So we're going to get onto your hands and knees. The key thing here is making sure that you are lined up. Your knees are below your hips and your hands are below your shoulders. Now, if there's, I know that wrist problems can be an issue. If you can't weight bear on your wrist, you could certainly go through the fist and do it that way. But if you can get through the palm of your hand, that will be best. And then what we're going to do here is find a neutral spine. So we're going to take the pelvis, take your lower back, and then round it out. So I'm going to push it up. You can see in the small window there. I'm going to push it out and round it out as much as I can. And I'm going to go in the opposite way, kind of sag into the ground. Tailbone comes out, tailbone comes under. So I'm looking at this motion up and down. I'm seeing, all right, I can go, this is as high as I can go in this direction, and this is as low as I can go in this direction, and I find the middle. Once I find the middle, I'm just going to tension that abdominal muscle that we've been working on, and then we're going to extend one arm and the opposite leg. Now, when we extend, we want to make sure that there is no shifting of the body. The body is completely straight, and we're not extending up to the ceiling. The key thing here is not adding movement into the spine. We want to make sure that that is as still as possible. We're extending one arm to the wall and the leg to the wall, making sure that there's very little side-to-side motion or extension or breaking of that position that we got in the beginning. All right? So again, 3 to 5 second hold each side. If you can get through 10, that would be great. All right? So those are the 3 exercises that we want to do for core strengthening. All right? So it involves the abdominals, the back, and the hips. Now, we touched on earlier about the hip flexors, the iliopsoas muscle that can be tight. One simple way to stretch that out is you can use like the bed. You can lie down on the side of your bed with both knees bent. And it's important that we have the hips as close to the edge of the bed as possible, but the shoulders away from the edge. So it's sort of like I get into this position where I'm kind of like diagonal. All right, and I drop this leg off. All right, dropping this leg off allows me to gradually, just real gently, stretch out the front part of this hip. And that's where that muscle is, that iliopsoas muscle. So we're stretching out the front part of your hip. Another way to do this is in sitting. So if we're going to be sitting, I'm going to grab my chair. And if you're sitting and you're at work or whatever, you can just get into a position where we have one knee up and one knee down to create that stretch. And it looks like this. So I'm going to be here, sideways, there we go. And I'm just going to get onto the side of the chair, and hopefully you can see me. I'm opening up this leg behind me, and I have one leg still out in front in a normal sitting position. This foot is, and knee is, the knee's not on the ground, but the foot is pulling my foot back or pulling my hip back. And I'm extending through this hip. The straighter and if you feel the stretch into the front part of your hip, that'll increase the mobility of this hip and reduce that stretch or strain on your back. All right. I find that a lot of times, especially if you are in a sitting position for too long, our body adapts to this flex posture at the hip. The hips remain bent, and every time that we go to stand up, or move out of this position, we have to extend or straighten the hip. And a lot of times if we're tight through here, we're not going to be able to extend and straighten the hip. What happens is that we get stuck at the hip and we can't stretch that out or open that up. So then we just get the rest of that motion from the back. And then we walk around with a partially bent hip and a tight or shortened back because those muscles are always trying to pull us up. We want to be able to get that straightening from the hip and not just from the back. Alrighty? And body mechanics. Body mechanics really require what we call a two-handed rule. The two-handed rule is what we talked about, is basically your sternum to your belly button or your pelvis. These 2 points should never become closer or farther apart when we go to move or pick something up. So we went through the movement in our hands and knees position, this quadruped position, where I went like this, rounding the back and extending the back, just feeling out my range of motion, okay? So that opens up the front. You can see how this part opens up, and then this part closes this down. If I'm in an upright position, get the side view here, we don't want that movement. So here it is in sitting, just doing that same motion in sitting. It's the same shapes that we were making, but we're in a different position. So when we're thinking, all right, I'm going to go back and forth, I'm going to find my neutral, find where my spine is the straightest. We're in the middle of those two ranges of motion, and I imagine 2 points from the sternum down to the belly button. As I move, that should not change. So as I go into standing and I go to pick something up, I am bending from the hip and bending from the knees, and I'm going to go pick something up. But those 2 points haven't changed, okay? I don't want to bend down and then break, and then all of a sudden I have my hands closer together. Or I don't want to go down and I break this other way where my hands come apart, and then all of a sudden I've got overstress on my back. So body mechanics are important, but the main thing that we want to focus on is having the two-handed rule, the points between sternum and belly button, as stable as possible.